Our guest this morning is a professor from Monash Health Department, one of the largest health departments in Australia. It's with great pleasure I'd like to introduce the Professor, Mr. Peter Karr, in our studios this morning. Good morning and welcome to our program.
Good morning. Thank you for having me on.
Doctor, first of all, now you being the head of nephrology, do you get invited overseas also, Doctor?
Yes, frequently. I have given more than 50 lectures overseas, usually invited to conferences because of my expertise in areas of nephrology, especially dialysis.
Okay. And now talking about kidney diseases, there are signs and symptoms of kidney diseases. How do we find out that we've got kidney disease?
That's an interesting question because quite frequently people with kidney disease don't know it, and there may not be any specific symptoms. Probably the commonest symptom is very non-specific, and that is tiredness. And if you think, the poor old GPs, how many people do they see every day who say, I'm tired?
Yeah.
And to try and find the ones amongst that have got kidney disease is quite tricky. So kidney disease, generally speaking, until it's very severe, has very mild or no symptoms, with tiredness, easy fatigue, perhaps in the later stages, shortness of breath or swollen ankles, things of that nature. But they're very non-specific often, and it's quite tricky for people to be alert to kidney disease, particularly for the patient themselves, but even for their GP.
Mm. Is there an age limit as such, Doctor?
Well, our kidneys do get worse as we get older.
Okay.
So I use the line, the guaranteed runs out at 25. Mm. And so after the age of 25, we naturally lose about 1% of kidney function a year anyway. If on top of that we've got some condition that affects the kidneys, then that can accelerate. And only till we get down to below 20% or so of kidney function do we start to get symptoms in patients specific to the kidney failure. So some kidney disease will cause symptoms earlier specific to particular conditions, but from the point of view of the kidney function declining, the symptoms are very late. The most common cause of kidney disease in Australia and most parts of the world now is diabetes. So they're the people we particularly target looking for kidney disease and signs and symptoms of it. The other important thing about kidney disease in that sense is that a large proportion of people with kidney troubles have high blood pressure as well. So the two go hand in hand. And unfortunately, the high blood pressure makes the kidneys worse over time, and the kidney disease makes the blood pressure worse. So they snowball off each other.
Okay. Now, there'll be a lot of people with high blood pressure. With talking about high blood pressure, is this type of medication you can have and overcome that?
Certainly, people with high blood pressure should be treated. They should be treated to a target blood pressure, and preferably below 140 over 80. And to do that, there are specific medications that lower blood pressure. From a kidney point of view, if there's coexistent kidney disease and high blood pressure, some blood pressure medications are better than others at looking after the kidney. The so-called ACE inhibitors and angiotensin II receptor blockers, that's a mouthful, we tend to call them ARBs. So those two classes of drugs are good blood pressure drugs, and they're particularly good at protecting the kidney over time from deterioration. That's not to say that other blood pressure tablets are bad. Other blood pressure tablets are very effective also at lowering blood pressure. It's just that those two classes of tablets are particularly good at protecting the kidney.
Okay. Now you spoke about the sugar levels also, high sugar levels. Now if a patient has, so he has to cure himself with the diabetic also to look after the kidneys.
Well, certainly one of the things about diabetes, as an example, is it's a condition where the patient must take a role in looking after themselves. So if you've got diabetes, then there's some restrictions on diet and there's some need to take medication. Now, it's up to the person to do that. They've got to look after their diet,
Okay.
preferably lose some weight, and take their medication. Now, the doctor can tell you as much as you like. When you walk out of the room from the doctors, if you don't do that, then you're not playing your role.
Correct.
In looking after things. And one of the most important things, in fact, is the weight. People get diabetes, the adult type diabetes, predominantly because they're overweight.
Yeah.
So working on that and reducing the weight is actually critically important.
Okay. Now you'll be having lots of patients having high blood pressure and high blood sugar. Now they are coming to you to get some advice with their kidney disease. So when they approach do you talk about their type of food they have to eat and all that? Or?
To some extent. So someone like myself as a kidney specialist would work in combination with a diabetes specialist.
Okay.
So often the sugar control is in the hands of the endocrinologist, the diabetes specialist, and will play a particular role with the blood pressure control and some of the issues that develop as kidneys get worse. The thing about kidney disease, and including in the situation of diabetes, but other kidney diseases as well, is that it's a slowly progressive path, and it often takes 5, 10, 15, even 20 years to go from normal to severe kidney disease. And in that time, there's lots of little bits and pieces that can happen that need attention. So I would often leave the sugar control with the diabetes specialist, and a lot of that is about diet and weight, but we would have some general advice in that regard. And one of the things that's important from my perspective is salt.
Salt.
Salt is a problem because it contributes to the blood pressure.
Okay.
And control of blood pressure is much better in people who have a low salt diet. And those drugs I mentioned before, those ACE inhibitors and ARBs, they work much better in a low salt environment. So if we can convince people to reduce their salt intake, then it helps the blood pressure tablets work and it helps the kidneys cope.
Okay. Doctor, with kidney diseases, there's no one knows that they got a kidney disease. Where do they start?
So that's a good question. Because we've said that there's not many symptoms of kidney disease, it then begs the question, well, who should we go looking for kidney disease? And I think probably the most important groups are people with diabetes and people with high blood pressure, and perhaps people in older age groups, over 65, but certainly the over 65s if they have high blood pressure or diabetes or a family history. Interestingly, in the perspective of your audience, the Sri Lankan people as a whole have a high risk of diabetes and probably kidney disease because of that. And that relates to a genetic quirk, if you like, that the body mass index, the BMI, that issue of height and weight that gives you a body mass index, the body mass index at which diabetes occurs in Sri Lankans is much lower than, say, in white Australians. So in white Australians, it's at a BMI of 28, normal being 20 to 25. In Indians and Sri Lankans, it appears that it's about 23. So you're built to be skinny. And unfortunately, even at what would be considered a normal weight in Australia, you may be at risk of diabetes. So that's the first thing. People need to be screened for diabetes, particularly the heavier people. And then if the diabetes is diagnosed, yes, they need treatment for their diabetes, but they also need follow-up over time with repeated checks over time to see whether they've got kidney disease. And the simple way of doing that is a blood test and a urine test. So the blood test looks for the function of the kidneys on a blood test, and the urine test particularly looks for the evidence of protein in the urine. So protein in the urine is a sign that things are wrong in the kidney, especially in diabetic kidney disease, but also in other kidney diseases as well.
Let me thank you, Doctor, for giving your valuable time and talking about kidney diseases. Probably I will invite you again next week to talk about a few other problems. And on behalf of Channel 31, all the staff, would like to thank you, Doctor, for giving our viewers and myself and the staff a very good advice about kidney diseases.
You're very welcome, and it's a pleasure to help.
Thank you, Doctor.